It is 8:50. We are joined this morning by Kecia Fulcher from Community Medical Clinic, and February is National Heart Health Month. So we're going to talk a little bit about some heart health and what Community Medical Clinic has to do with that. Good morning, Kecia.
Hey, good morning.
Thank you so much for coming in again.
Oh, you're welcome. Thank you.
And so it means a lot to me that you get your morning going and come an hour away and come in here to talk to us.
Yeah, well, I appreciate it. My coworkers know that I'm a little bit more of a night owl, but I do appreciate the chance to come in on the morning shows.
Well, we're glad to have you here on Coffee Talk because, without your help, we couldn't get the word out. We couldn't let people know.
Yeah.
It does mean a lot.
Yeah, kind of wearing my, it's a little bit burgundy red, still wearing the red. And you've got on red this morning, too.
I do have some red mixed in
Yeah,
here.
for Heart Awareness Month, for the, I wanted to talk a little bit about cardiovascular health. And I find people, I'm not a doctor, but I do have good statistics and information to give. Community Medical Clinic has been a recipient of a federal cardiovascular outreach program grant. There are 12 of us nationally, and we have meetings with those telephonically, those other people, so that we can see what is being completed or done throughout the United States to help improve heart health. In order to this grant, we had to form a consortium of community partners, and I'm happy Pennyroyal Regional Prevention Center, the American Heart Association, the Kentucky Cancer Program, and the American Cancer Society are our community partners. And we were working with them on different projects already, so it made just perfect sense, to work on this project together. It's to try to get more information out to the public. It's also to do initiatives to improve, exercise and focus on diet, and then the medical side of it, checking, making sure about your blood pressure, all, weight. And then the reason some people may have wondered why the Prevention Center and the American Cancer Society and the Kentucky Cancer Program, that we included them, is because one of our biggest initiatives is smoking and tobacco cessation, because that's probably the number one preventable, lifestyle choice that not only impacts cancer, but also heart disease. And so that was something that it was a crossover. And I think that was one of the reasons we were funded, because we're looking at, with Kentucky being, of course, a tobacco state, and we do have a large number of people that smoke, and we're number one in lung cancer, that I think nationally they looked at that. Matter of fact, in Christian County, men's lung cancer was like one of the number one in the United States. And they, I know the health department and the Kentucky Cancer Program received a CDC grant additionally to look at lung cancer. So, it was a way of also trying to fund and look at it from a heart health perspective. Heart disease is the number one killer of women over 20. It's largely preventable, like I said. Stroke is related to a lot of the same risk factors, and it's the number 4 killer, and also the leading cause of disability in the United States. And, we just wanted to call attention to some of these facts during the month of February. More women die from heart disease than all forms of cancer combined. That, to me, is a startling statistic. I mean, how many of us are not impacted by someone, family or friend that that has cancer? The same is true with heart disease. Think about it. People that have had heart attacks and died, or have heart attacks and then have disabilities as a result after that, or, higher risk factors. One of the statistics is that there's 8 million women in the United States living with heart disease, but yet only 1 in 6 really believe that heart disease is a risk factor for them. And this one just really struck me, because we spend a lot of time talking about breast cancer in women, and we should, but 1 in 31 American women dies from breast cancer, but 1 in 3 dies from cardiovascular disease. Now, that just blew me away because I would have never guessed that it would have been that big of a difference. So it is really important that we talk about it, and that we not only talk about it in general, as with men, but also with women, because it's all of us. And we all, have some of the same lifestyle issues that can contribute.
Like the cookies.
Yeah, well, I know I just recently started back to go into the gym, and then I had an accident and broke my leg, and so I had to be off for a few months, and I've just started back, and it really does improve how you feel, your quality of sleep. I mean, there's lots of things that exercise can really help. And if you can't go to the gym, most of us can walk or we can move. There's, different things that people can work with you to give you a modified exercise schedule if you have some issues, like when I did some things, while I even had a broken leg, just you got to keep moving. So, exercise, our diets, not enough can be said about diets. I was listening to a program the other day, and they were talking about how the recommendation really is to eat about 9 vegetables a day. And they've always said 5, and I think the reason they've said 5, fruits and vegetables, is that is more attainable. That most of us can probably get that, but there's a recommendation that we get 9, and it said, if we shift to things that are, fresh versus processed, and how it can make such a difference in our health. Of course, we want you to come in and get an assessment. With Community Medical Clinic, we do have the program director for this grant is Rhonda Neighbors. Rhonda is an RN, and she works in all of our clinics, but her main office is in Hopkinsville. And, she can help you. She can hook you up with, services if necessary, and talk with you about risk factors. Helps with getting people nicotine replacement, for example, if that's necessary for the tobacco and smoking cessation. We have groups. The Kentucky Cancer Program has been doing those groups. The Pennyroyal District Health Department, they have multiple locations where they're not only doing exercise programs, but they're also doing the smoking cessation. And I left out the Christian County Health Department when I said Health Department, but they are also, and they have been doing a walking, walk to the moon kind of program where you keep up with your miles, and trying to do group efforts for people to move and get more exercise. Maybe we need to talk a little bit about, things to look for as symptoms if you were to have, symptoms of a heart attack. Again, I say I'm not a provider by any means, but, the basic ones, of course, people think of chest discomfort and, pressure, but there might be, discomfort in other parts of the body, such as the back, the neck, the jaw, or even stomach. And with women in particular, it tends to be some of those that you don't think about, shortness of breath. And then, sometimes people will break out in a cold sweat or feel nauseous or have lightheadedness. You might feel irregularities in the heart, the heartbeat itself, especially if someone has an AFib issue. You can feel that sometimes when your heartbeat is irregular. So we want to encourage people that it said women are harder to call 911 when we experience symptoms. We don't want to bother anybody. We don't want to make too much of it. Men tend to not want to go into the doctor to get checkups. Women, we're better about that. But when calling 911, we tend to do that less. And I think that could contribute to some of the reasons why there's more deaths, because we wait too long. Of course, if you have high blood pressure, that is silent, and a lot of times you don't know it. I know I was diagnosed with it a few years ago, and the number one thing is to stay on your medications and, come in regularly. Every probably 4 to 6 months, you need to be checked by your provider if you have a high blood pressure. Same that way with cholesterol. Sometimes those issues tend to run in families, and sometimes they will prescribe medicine, or maybe it may be a diet. That's why it's important for you to have a conversation with your provider specifically for you, because, there may be different factors that contribute to it in a family. And, of course, overweight and obesity and diabetes, they are all contributing factors. So the best thing there is to get moving, take your medicines, drinking water. I see you there with your drink in your hand, keeping you going this morning. So, be sure and drink lots of water throughout the day, because that helps to flush out the bad stuff. And, the main thing is just us taking charge of our own health and working with our providers, to do that. I have, some individuals with heart conditions, and, we talked some about my sister and the cancer last month. She had heart condition, and I said, before that had masked the symptoms of the cancer that actually killed her. But hers started as a result, her heart problems, of some dental issues that she was having. That's another factor that people don't think about, because endocarditis, which is an infection that affects the heart muscle, a lot of times will start as a result of an infection in the gums or an abscess in the teeth. So that's another area where Kentucky is especially at risk. We don't think about our dental. It's sometimes seen as a luxury rather than a real health. I went to my dentist yesterday, so I really have that on my mind today about prevention and how, I just remember this weird fact from years ago that it said, if you go to the dentist regularly, you can increase your life expectancy by about 7 years. And to me, that was just to go twice a year to the dentist, even though it's not always the most enjoyable thing. Sorry, all the dentists out there that might be listening. It's not something, and that's why people don't want to come in sometimes and get their physicals or get their checkups. We don't sometimes want to deal with things that we don't like or we don't consider pleasant, but really, if you take care of something when it can be prevented or go further, then that's the best route, rather than having a catastrophic event to occur. So we just want to encourage people to come in, particularly this month while we're focusing on it, get their checkups, schedule an annual physical. If you have high blood pressure, make sure you're taking your medicines. Make sure you're coming in regularly. You're checking it. There's lots of places now. Drugstores, groceries, Walmart. There's lots of places now where you can check your blood pressure if you don't have your own. And one of the things that we want to do through this is we are going to be providing some blood pressure monitoring kits to some of our patients, that are having trouble stabilizing their blood pressure. And then we're going to work together again for the tobacco and smoking cessation, increase in physical exercise, and just awareness in general.
Okay, Kecia, and who do we need to call so we can get started in getting our health on the right track?
Okay. We have 3 locations at Community Medical Clinic. We have the location here in Princeton. It's at 310 Hawthorne. The number is, of course, 270-365-0227. We have the clinic in Hopkinsville at 1102 South Virginia Street. The number there is 632-6741. And then we have our Oak Grove Clinic, and it is at 244 Thompsonville Lane, and the number there is 632-6743. So, you can call any of our locations, and we will be glad to get you in for a physical, and or if you have some questions specific about the smoking cessation or something to do with cardiovascular health, we can get you to Rhonda Neighbors, who is our project director for this.
All right, excellent. Kecia Fulcher, Community Medical Clinic, thank you so much for coming in today.
Thank you for having me, Misty.
Yeah,
I appreciate it.
I really do. And incidentally, February is also National Dental Health Month.
Okay.
So National Dental Health and Heart Health. Just, be healthy.
Yeah.
Just get your checkups. I do the every 6-month thing. I don't like going to the dentist, you're right, but I do it because, it has to be done.
Yeah, we got that plug in there too then.
Yep, that's right. Thank you so much, Kecia.
Thank you.